everybody. Welcome to the Silver Lyming. My name is Anne Desjardins. I'm your host for this show this afternoon, and I'm just very grateful to be here today. Again, having healed from Lyme and tick-borne illness myself, to share this podcast with you because it was a very long journey back to health and wellness, and then also to be able to share with you other stories of people who have recovered themselves. I find that it's very important for those going through this problem to have other stories to anchor themselves to help bolster their spirit along as they're going, because it is definitely a very lonely and dark place to be when you're stricken with Lyme and tick-borne illness. And to have stories of others who have gotten better just really helped my soul have enough strength to move forward. And so I'm looking to hopefully give that back to this community. But also, I really want to raise awareness for people. If you're not very familiar with Lyme and tick-borne illness, it presents in many different ways. And that's another part of this podcast, is there's so many different stories and so many different people who have gotten better. Today, I have two guests with me that are, one, a practitioner, somebody who helps to serve the population, and then someone else who has actually been treated by this person to regain their health and their life back. And I know the magnitude that that holds just when you actually can feel like a human again. I was taken into zombie zone, is where I'll call it, and have come back amongst the living and can function again. And it's just a really beautiful thing. So people who are able to provide value to the sick population are definitely welcome here. And so without further ado, I'm going to introduce my first guest today. I have Dr. Warren, Dr. Daniel Warren from Envita. He works at a practice, I believe, in Arizona. And he's got quite a few different patients that he sees, I'm sure. He's been practicing now for 10 years. And so if you don't mind, Dr. Warren, if you could just tell us a little bit more. I know I had sort of asked you what really brought you into this space, if it was personal experience or just true passion that has brought you to serving such a tough population, if you will. If you don't mind, just share with us a little bit more about that, that would be great.
Yeah, my pleasure. Thanks for having us. So some practitioners, sometimes they have family members or have personal experience with Lyme that kind of draws them to see this patient population. That wasn't the case for me. For me, I kind of got into medicine with the desire to really see people's lives change. And, I really wanted to serve people and see that healing response. And, especially with this community, we see very, very late stage Lyme patients where they're difficult cases, but it also affords, a pretty big healing opportunity. And so I think that's kind of what drew me to work with Lyme patients, because, I got to see people get better. I got to see people get their lives back. And, one of my favorite things, honestly, as a practitioner is, being able to be there that first consult and see patients who don't have good quality of life. They're not living life the way that they're meant to. They're kind of a shell of themselves, and see that transformation and over the course of treatment, and, see them kind of blossom to become the people that they were meant to be. And, to me, that makes it all worth it. So that's kind of where that passion comes from, is just really being able to see that healing in people. And that's a great population to work with for that. So
I can imagine how rewarding that would be. Is, again, looking at my own personal experience, I can see pictures of me at the height of my sickness. And there was no life in my eyes. I looked like a dead person. There was nothing there at all. And to see myself now, I don't even look like the same person. So I can imagine and appreciate the joy that you get out of fixing people and making them better in that space. I'm not sure if that's quite the right word for it, but fulfillment, satisfaction, just knowing that what you're doing matters, because it can be definitely, obviously, very hopeless. And especially when you go, a lot of times people who, first of all, they don't even know what's wrong with their body to know what kind of doctor to go to. And they get bounced all over the place, told that they can't do anything, et cetera. And it's kind of crazy to me, the number of people that I deal with that tell me that their doctor said that they can't get better or that they can't fix themselves. And I say to that person, well, sorry, you can let your doctor know that they're not God. First of all, they do not have the right to tell you that. It is very possible to heal your body. It is very possible to undo a lot of the damage that has been done to us. Maybe we don't come out exactly at the same place where we came in. But for me, I feel like I came out on a much better place than where I went in, because I understand my body that much more, and I'm that much more aware of the things that I need to do for myself to keep myself happy and healthy. Yeah. Do you, when you're working with somebody, so if somebody comes to you and they're like, oh my God, I'm so sick, what what do? Are you running tests on the person first? Are you really starting on a protocol? Like, do you use Bruner's protocol? Are you using herbs? How do you treat people?
Yeah, great question. So, going back, I think, so what you just said, I think there was something really important that you just said is, I think the first step, and this happens in the first meeting when I typically meet with patients, is just providing that hope, because like you said, a lot of times patients have been everywhere else. They know something's wrong with their body. They have been told that nothing's wrong because all the labs are normal, and they get misdiagnosed with various conditions. And it takes all of your hope, and it takes all of that fight out of it. And so I think the very first important step is just providing that space to allow patients to know that, there is hope. You can get better from this. I think that's really powerful in itself. So that's kind of the first step. More on the additional steps that are important, obviously, in fighting this disease. Labs are a huge part of it. So, I'm a data guy. We're a very data-driven clinic. And, as we were kind of chatting prior to recording here, what we typically see, because we see late-stage cases, usually it's not just Lyme that we're dealing with. It's Lyme plus other infections, co-infections that ticks can also carry. There's secondary viral, parasitic, fungal infections that jump on board. You get a variety of toxicities. There's mold exposure. There's a lot of different factors that go into this. And the reason why being that you get a compromised immune system, our main defense over time, and all the things that we are susceptible as human beings living on this planet that our immune system can normally fight off, they jump on board because there's nothing to stop them from jumping on board. And so the reason why this is typically a progressive disease is because those things are making a person sicker and sicker over time. And so in order to get a person well, you have to identify all of those factors. What I always tell patients is that if you miss a major piece of the puzzle, it's really difficult to get somebody well. So we do really comprehensive testing up front in the beginning to identify all of those root factors. And then we have, different strategies to address those factors depending on what we find. It's very individualized. I think, in my experience, the only way to treat this disease is to have an individualized approach. If you have kind of a one-size-fits-all model, it's not typically going to be successful because every Lyme patient is different, not only in terms of how they present, but the factors contributing to their disease is different. And so you have to treat every person as an N of one, as a person of one, and address everything individually. And so the first step of the process is figuring out, okay, what are all the contributing factors? And then what we do is we utilize a variety of natural and conventional treatments to address those factors. So mostly what we do is IV care for two reasons. One, especially when it comes to the antibiotic side of things, because we do use antibiotics. Most Lyme patients have a GI tract that's compromised. It's not working properly. And so, with oral antibiotics, the biggest risk is you're essentially killing all the good gut flora. You're setting off this bomb that's going to make things worse. And so we don't do a lot of oral antibiotics for that reason. The other reason is that IV antibiotics typically they're just more effective. And so we're usually doing a combination between different natural treatments, orally and IV, as well as appropriate antibiotics depending on which bacterial infections that we find.
Okay, that's helpful. I mean, I'm trained as an Ayurvedic practitioner, and so I think about a lot of times with bioindividuality, figuring out really what the root cause is for each person. We are all comprised of the 5 elements. We have different balances within ourselves. And so each person is obviously going to need different treatment paths. And of course, then you're adding in the cofactors and comorbidities, things like that really drive how symptoms present themselves. So I think that's obviously a very good idea. And you're making me think about with IV antibiotics versus oral, obviously then you're bypassing the liver, you're eliminating that entire process, which can actually heat up people's bodies more and make them sicker if you're really taxing the liver that much more extensively. So I gratefully did not have to do them. I'm a little bit squeamish about needles, so I'm definitely kind of glad I bypassed that whole thing. But I do understand the purpose and why that can be much more effective.
Mm-hmm.
Also, curiously speaking, are you familiar with ILADS? Are you an ILADS trained physician?
Yeah. So we have several docs here that treat Lyme, and we're all ILAD certified. I think it's great to have organizations that certainly bring awareness to this disease because, as you said in the beginning, it's something that's vastly under diagnosed. There's not enough attention research-wise, treatment-wise to this disease. I think it's so much more widespread than anyone has any clue about, to be honest with you. And so I do appreciate having organizations like that that bring awareness to this and have a platform to help people. So,
yeah. And I think me personally, I'm a little bit more in alignment with their philosophy and just how they actually treat people. And they look at more of a holistic system instead of just saying, here's your standard treatment and you're going to be fixed and you should be better now. And yet we've proven in however many experiments and trials and whatnot that the spirochete continues to exist after the standard 28-day treatment. But we're just going to pretend that that's going to do it for people.
Yeah.
So I'm glad, again, to hear that you're taking more of a holistic approach with how you're looking at people and the entire human system and working of that. Do people come to your facility as like local people? Can you see people from all over the place? What does that look like? If I wanted to come see you, I live in Pennsylvania, how would I come to your facility?
Yeah, great question. So most of our patients are out of state or out of country. I would say probably close to 80 to 90%. We do see local patients. One thing I've learned in treating this for many years is that, the CDC that kind of recognizes that only certain areas of the country are endemic for ticks it's just really not true. We see patients from every state, all 50 states, multiple countries. It's really everywhere. And certainly there's some areas that are more endemic than others. Of course, you're going to see more in the Northeast and the Northwest. So we do see more patients from those areas. Arizona has less of a tick population. So I think that's probably why we see less local patients. But we do see some. But most of the time, if let's say a patient is on the other side of the country and they hear about us and they want to come see us, then we have coordinators that we work with that essentially will reach out to patients, or if patients reach out to us, then they will communicate with them to be able to educate them about what it is that we do and what we can offer, and then start that process going in terms of trying to determine, is this a good fit on both sides, right? Because it has to be a fit for the patient and has to be a fit for us as well. So.
Yeah, sure. And so, but like, do people come there for extended periods of time? Do they just come in for an appointment?
Great question. So yeah,
plans available for people to help them, because I know how much I spent to fix myself.
Yeah.
And I know that a lot of times people are a little incredulous to understand this fact, but many times insurance does not cover long-term treatment of Lyme disease. And so I don't know with your facility, like how does that look and how would that work for people?
Yeah, no, great question. So most patients come out for an extended period of time. So you're essentially, moving to Arizona for, I would say a typical protocol is anywhere from about 8 to 12 weeks. So you're looking at usually about 2 to 3 months of, fairly aggressive treatment. It seems like a long time, and it is a big commitment, certainly. But one of the things I tell patients is that, especially since most of our patients have had this for years, sometimes decades, sometimes their entire life, we're trying to reverse a lot of dysfunction in the body in a relatively short period of time. So, it is a big commitment to obviously move to another part of the country. But in order for us to do the treatments that we need to do, we need to do them here. We're specifically in Arizona because of our scope of practice. It allows us to do the variety of treatments that we do. And so patients will come out here for extended periods of time. In terms of the financial side, as you mentioned, most Lyme treatment, unfortunately, is not covered by standard insurance. which is really unfortunate. I wish that it was. A lot of what we offer, we do is the best that we can to do things that are covered to get coverage for patients. We do offer third-party billing as well, so patients can sometimes get coverage on the back end. And there are certain foundations that patients can get affiliated with that can offer to cover treatment in some cases as well. So there are some options for patients, but as you mentioned, a lot of times it is a lot out of pocket, unfortunately. So that's certainly a challenge, because obviously we're here just like you're there to help as many people as possible. And, that's our mission, is to see as many people get well as we can. And sometimes that can be a roadblock.
Yeah, which is very unfortunate, because every human on this planet deserves to have a good quality of life in terms of their health, and to feel okay, and to be able to function, to get out of bed, to be able to cook food for themselves, to be able to do their laundry, to be able to remember where they're driving, or the names of their loved ones for that matter too. Lots of things that get taken away when you have Lyme and tick-borne illness. And like, I had to get a different job. I had to get another job. I'm just thankful that I could work, but that's about the only thing that I could physically do for myself to survive. And the rest of the time was spent drinking a lot of alcohol and trying to figure out what was happening to me, because doctors just kept telling me there was nothing wrong with me. So, but again, it's very unfortunate. And we spent a lot of time. I'm part of the PA Lyme Resource Network here in Pennsylvania. We actually will go to the Capitol and do our best to push forth different bills and things to get passed through the House and the Senate for us to actually get better insurance coverage. Some states are better than others. Pennsylvania is not so good. But I think about even a population like the homeless population, for example. In my opinion, they're very susceptible to this kind of thing. And if I think about a lot of homeless people, maybe it's just my weird view of them, but a lot of times I feel like many of them have mental illness, and I'm like, yeah, they probably have tick-borne illness, and they don't know it, and they'll never know it, and they can't afford treatment. What do they do? My friend does a thing where he does blankets for hope, and I've talked to him about this, and can we spray the blankets with permethrin before we give them out, so that maybe we can help to keep people a little bit safer from coming into contact with it, because it is almost a disease of the luxury, if you will, or the people who can afford it. It's terrible to get treatment and to get your life back. It just shouldn't be like this, especially when there's practitioners like you who want to help people and are sort of tied by that. Your time is obviously worth money. And so there's got to be some kind of exchange happening. You can't just work for free for everything. So hopefully someday that gets a little bit different. And then when it comes to testing, what kind of testing do you use? Because I know that this is another common problem that people, I think, don't quite understand well enough, in that your standard 2-tier testing, the Western blot and the ELISA, are terrible tools, in my opinion. 50 to 65% accuracy at best. Do you have a specific lab? Is there something that you can maybe recommend to people who are trying to get through that testing phase, like go to this place instead, or use this lab, or can you help to explain possibly why some of those tests aren't sensitive enough?
Yeah, great question. So I 100% agree that the conventional testing is terrible. I think that's honestly one of the main reasons why it's so vastly underdiagnosed, because there's so many false negatives with the testing. You go to your primary care, you go to an infectious disease doc, you get a standard Western blot, it comes back negative, and they move on. You miss the diagnosis. And so when it comes to testing for us, there's basically 3 different ways that I've seen effectively test for this. There's 2 parts of the immune system, which are your B cells, your antibodies, and your T cells, which are your white blood cells. And you can do testing to look at both sides of it. So a lot of the testing, like Western blot, for instance, looks at antibodies. So it's your B cells. Tests like IGeneX, I think, is a great alternative, because not only do they look at the standard criteria, which, we don't see CDC positive IGeneX testing very often, because it's just the criteria is just too stringent. But they have their own set of criteria as well to look at, is it positive for that other set of criteria to be able to to capture that positive test. So I think testing like that, to look at it from the antibody side of things, the biggest challenge with, in each type of test has a limitation. I mentioned two, the third one being DNA-based testing, meaning that you're looking for DNA of these infections actually coming out of the body. And each one has a limitation. There's no perfect test, unfortunately. Those that are dependent on your immune system, if you're severely immunocompromised when you do the testing, and especially if you haven't been doing any treatment prior to, you could get a false negative. The DNA-based testing, the limitation there is that if you're not actively killing these infections and they're hiding in the tissues of the body, and you're not eliminating that DNA, you're not going to see anything come out of the urine. It's usually urine-based testing. So there's certain strategies that you can employ to try and improve the chances of those being positive tests to capture an actual diagnosis. But for that reason, we typically will not just do one test. Usually we're doing multiple tests to look at it from different angles. So that way we're not missing the diagnosis, because, even though I think the testing that we do are much better than the conventional testing, like I said, there's still limitations. And so if you do multiple types of tests, you're more likely to accurately get that diagnosis.
I think that's a very valid point. And in my brain, what I consider this is the ultimate shapeshifter, right? This illness is the ultimate shapeshifter. It is so smart. It knows how to hide. It knows how to evade. It knows how to throw people off its trail, its scent. And so you would almost have to look at it from a multi-angle approach. You can't just look at it straight on. And that's a lot of my complaint with the CDC's criteria too. As you say, it's so stringent, and we know that that's not the case. What I always want to know is, how does somebody have anything in their body that relates to Lyme if they don't have it? If they're not testing positive to all 5 bands that the CDC says that you have to have 100% certainty, but maybe they have 2. If they haven't come into contact with it, how do they have it in their body at all?
Well, there are certain, so if you look at the different bands that are tested, there are certain bands that are more Lyme specific than others. Mm-hmm. So for instance, bands 41 and 31 are less Lyme specific than, say, like 83 to 93, 23. Those are a little bit more Lyme specific. So the reason why is because you can have what's basically called cross-reactivity, meaning that you can have other infections that can yield a potentially positive result on certain bands for those less Lyme specific bands. So depending on which band you have, even in cases for us where we're looking at, that testing, even if it's not enough to show a positive result, I'm still looking at the bands to say, okay, is there still some evidence here of, possible tick-borne infection, even if the criteria weren't met? Because that still gives you data, that still gives you information to kind of put the puzzle pieces together. What I've seen is that when it comes to diagnosing this disease, like every aspect of this disease, it's very challenging. And so, what you need to do is you need to put all the puzzle pieces together. So it's not just about, the testing, it's about, does the clinical presentation match up? What's the history like? Have the risk factors, do those match up with what you typically see for a Lyme case? So you're kind of putting all of that together when you're making that diagnosis, not just looking at numbers. I mean, certainly the data is important and you want to have that objective measure to confirm the diagnosis, but you also want to look to see, okay, are you seeing typical Lyme symptoms? Have they been exposed to ticks? Have they lived in endemic areas? All of those questions need to be asked, and hopefully everything lines up to be able to have a definitive diagnosis there.
Okay, that's fair. And maybe as a final question for you that you've sort of led me to maybe is, do you think people actually ever get cured? Or do you think people go into remission? When you had reference to actually killing things, my head's like, oh, do we actually kill them, or we just put them down enough that we don't feel them anymore in the body? Yeah,
great question. So it's a question I get asked often by patients, actually. And for most of the infections that are associated with Lyme disease, you can eradicate them. Now, a lot of them are so common that there's always a chance for re-exposure. So for instance, Epstein-Barr virus, which is very, very common with Lyme patients. you can kill it, but it's so ubiquitous in our environment that there's definitely a chance of re-exposure. So it's not just about killing the infection. You got to get the body strong enough, the immune system strong enough to be able to fight off any future exposures if you want to have long-term success. So in a lot of these kind of secondary infections, even some of the co-infections, you can kill those, you can eradicate those. The one that I usually will tell patients that you really fully can't eradicate is Borrelia, and which is, the main bacteria that causes Lyme disease. The reason why, and the analogy that I like to give to patients, is that the body has a really hard time getting rid of anything that hides in the neurological tissue. So the example I like to give is, if we think about herpes simplex 1 and 2, so herpes simplex 1 causing cold sores, 2 causing genital sores, once you get exposed to that virus, you're always going to have it. It's there permanently, and because it's a neurological virus. And you can go months, years without ever having an outbreak, but when you get stressed, when the immune system gets compromised because of that stress, then that provides an environment for the infection to come out. And the same thing is really true for Lyme. You can get well and stay well, just like you could, never get an outbreak again from having herpes. Same thing is true for Lyme. The way that you can achieve that is you knock down the burden of infection low enough, and you get that immune system strong enough where it can keep it in check, and then you can be symptom free. But this idea of it being cured or fully eradicate, it's always going to be there, which is why there's always that chance of reoccurrence, especially in times of high stress when the immune system might not be able to fight it off. So that's the one exception where there is always that chance of reoccurrence, which is why I tell patients this is a lifelong process. It's a lifelong healing process. It's not like you get well and then you live a normal life. You have to be committed to keeping that immune system supported and detoxing the body and doing all of these things to minimize that chance of it coming back, because there is always that chance of it coming back.
Yes. As I say, it's the lifelong accountability partner I never wanted in good health.
Yeah, it's true.
Yeah. And it is. It's like the minute you start, like I've actually almost really embraced the lifestyle change, and I'm grateful for it in the end. Like I had mentioned before, I went into this as a completely different person and came out with my eyes a lot more open, if you will, and just being in touch with my own body. But like, I'm committed to that. And if I deviate off my standard course, I start to feel it. Like I'll get a little twinge or something, after so long. And so many people that come on my show have the same thing. And it's like, yeah, you're turned into a new person. And my dad's like, how do you eat like this? How do you keep going? And it's like, well, when you're as sick as I was and you feel so much better, it's really not that hard. It's a pretty simple choice to make, because I know how much better my body feels this way versus the old way. And this is the new improved way, and it's a lot better, but it is something that you really have to ultimately commit yourself to.
Yeah, absolutely.
And I think going back to a question I had asked you, just in terms of patient success, I think that also plays into that, right? Like, what is the commitment level in a sense? And something I think about many times with people is like, why did I get better? And why is that person not? And I still don't know if I have the right answers, but I think a lot of it sometimes comes down to truly like radical commitment or radical belief in the fact that you can get better. Yeah. And sometimes people are their own stumbling block and they don't even realize it. Like they're more connected to the idea of being sick than they are to the idea of getting well. Yeah. And I can almost see it when I talk to people. I would wonder if you can too. Like I almost know who's going to get better and who's not, just by how they talk and the words that they use and excuses versus no excuses kind of a thing.
Yeah. Yeah, I would agree with that. I mean, it's really a partnership, where I see success is where, both sides are fully committed to the healing process. And, we ask a lot of our patients and, we're very upfront with patients about the commitment that it takes to get well, just because, we've seen that it takes a lot of work to reverse this, and it's fixable in most cases, but you have to be committed, and it's not just for the patient side, it's from our side as well. And it's this partnership that has to happen. So certainly the patients who are all in and they're, committed fully are the ones that always do the best. Now, obviously there are other factors that go into it. There's physiological factors. Sometimes there's genetic factors. There's, detoxification factors. There's a lot of things, on the medical side that can also speak to that. Why do some people get well really easily and some people have a harder time with it? But certainly to your point, commitment is a big part of it for sure.
Yeah. And I think maybe too, it's just really honestly like believing that you can get better.
Yeah.
And people don't believe that. And they believe that you're just going to stay sick forever. And that's kind of what happens.
Yeah.
But
and I think some of that is, especially for people who've been dealing with this for so long. And again, we kind of started by talking about losing that hope and losing that drive. Sometimes, it's really important to get that back in order to have that healing process. So that's why I kind of had mentioned that that's the very first thing that we cover is, you got to get that hope and optimism back to feel like you can overcome this, because, for patients who really identify with being sick and don't feel like they can get better, that mental part of this is so powerful that it's really hard to heal if you don't see yourself healing,
Yes.
So, a lot of what we do is to try and provide that hope and optimism and not only from the doctor to patient side, but also patient to patient side. The way that we kind of set things up is to allow the shared experience so people can go through this together, to know that they're not alone, but also that, there is hope. And that's such a key part of this.
Huge.
Yeah.
Huge.
Yeah.
That's what kept me alive a lot of times. So, in light of that, I think this is a good time to introduce Sarah here, one of your patients. And I know her story will help to give some people some hope as well. And I appreciate your insight and your willingness to just be open to the questions that I have for you. And Sarah Schlichte joins us. She is a patient of Dr. Warren's, but then also, I believe now after her experience, and I'll let her share more of that with you, obviously, but I believe she's become an advocate and actually works for Envita now because of the success that she had there herself in getting her health back. So Sarah, thank you for being here with us today. If you would just share a little bit more about your story with Lyme and tick-borne illness and how you've gotten back to health, please.
Yeah. Thank you so much for having me. I've been enjoying the conversation, and Dr. Warren's expertise is huge in the Lyme realm. So, like you said, my name is Sarah Schlichte, and I'm a patient educator and advocate. So I went through, like so many people listening to this podcast, went through really like 17 years of going downhill. I actually did have a bullseye rash my senior year in high school, had no idea what it was. I was told it was an infected spider bite, and began having gradual symptoms from that point forward. So I'm 46 years old, and Lyme has been a significant life-altering factor for me over and over. And by the time I found Envita a decade ago, I was very advanced neurological. I had a diagnosis of chronic fatigue, fibromyalgia, chronic pain syndrome, and Lyme was never brought up. I didn't know people in my world who had Lyme. And so, by the time, like Dr. Warren said, it's what makes Lyme disease so hard is when it's in the central nervous system, when it's impacting the neurological side of things. And I've talked to so many patients over the years now who, when they're describing symptoms that don't make sense over and over, I'm like, yeah, that's the neurological side of it. So I went through my own huge epic battle of just trying to find adequate medical care in New Mexico. I've tried to do the same in Colorado. And so after I found Envita, this was over a decade ago, I went through treatment. It was life altering. We haven't talked about the IRAD protocol that Envita does. It's very exclusive to Envita. It's allowed to operate in Arizona, and it stands for insulin receptor antibiotic delivery. And it's very strategic as far as how it gets those IV antibiotics past that blood-brain barrier. So for me, it was literally life-altering. Like it was like a switch went back on in my brain, and I could think, I could articulate, I was able to start walking again. So yeah, it's been huge for me. And way before I worked for Envita, after I went through treatment and recovery and remission phases, it's a long journey. I, in the same regard you did, Anne, like I didn't want people to suffer. And so I hosted for about 6 years a podcast called Lyme Voice. And from the social emotional perspective, I'm not a doctor, and so I don't try to weigh in on that side of things. But from a social emotional perspective, like you guys have said, this illness is so life altering. It's so isolating. And you really do become, I called it disappearing from my own life. Like I was not an active participant in my own life. And so Envita was huge for me, gave me a fighting chance. And there is so much hope for people. And most of the patients we talk to now, by the time they do call Envita, like Dr. Warren said, they're a decade into their journey, their decline. And so it's huge to be able to go in and offer people from the advocacy health perspective. I did that a lot, be able to offer people hope and keep fighting, don't give up, keep fighting. My coaching program that I did for years was called Fight, Heal, Live. And I called it fighting as a mindset. Like you got to get your mindset towards health, like you already addressed. Healing consists of choices. We don't always know what those choices are, whether it's diet or, nutrition or IV or herbals or whatever it is. And then living is the outcome. And that's like that goalpost. And Dr. Warren and I have talked about this over the years, that goalpost. If you're not living, if your quality of life is not where you want it to be, those are those indications to take action. So I've been able to do the advocacy side and then also the patient education side through Envita. So it's offered me a second chance at life, the protocols that Envita utilizes. So it's not the only thing I did. Like every other Lyme patient, you have to do it all. There's not one silver bullet. There's many pieces of the puzzle, but Envita does have a strategic approach for people who have those advanced neurological issues.
Yeah, I think about all the things and people are like, what'd you do to fix yourself? I'm like, how long do you have? Because I've become an encyclopedia of ways to fix your body because I know I've tried like everything and I'm glad that it all worked cumulatively, but there was no one thing that I was like, oh, I just took these pills and I was better. Oh, I just did. No. Like I did dry brushing. I did salt float tanks. I did essential oils. I did Reiki. Everything and anything I could think of to fix myself. I'm curious when you were going through Sarah, like how long did it take for you to get better once you started treatment? And were you experiencing a lot of herxing through the treatments that you were receiving?
So I tell people, and again, my whole story is still on Lyme Voice. You can go back and watch all the conversations over so many years. So, I went through treatment in 2013, and I say it took me about a year and a half, to get back up to the point of being able to do cardio, ride a bike, lift weights. It was very incremental, and I was operating at a very, very low level. I was totally bedridden. So for me, that was, Envita gave me the fighting chance and kind of got me back up and functioning where I had less neurological symptoms. I was sleeping more, I wasn't having seizures. That's always really helpful for getting through your day is not having seizures.
Yeah.
Yeah. So I say it's about, for me, it was about that 1 to 2 year mark, and I had a lot of atrophy because I had been in and out of a wheelchair. So that was a big component, but it gave me a fighting chance. And then being able to talk with doctors as a patient, this, you talk to people, especially in conventional medicine, and you think you're doing everything you need to do and know to do, but you're just being offered medications for symptoms. And so talking to doctors who not only understand the illness, believe you, but actually have a plan of action to address the neurological side of things is just so refreshing. So you get to the point where you're like, okay, this is working. I want to keep going. So that was your first question. What was your second question?
Did you have a lot of herxing going through this treatment? Was this something that you felt a lot about?
So what's interesting about herxing is I had been on oral antibiotics before I came out to Envita because I didn't actually have a full diagnosis. I had a fibromyalgia, chronic fatigue. So it wasn't until I went to Envita and did a full comprehensive testing and actually figured out what was going on. So I was scared to go on high dose antibiotics because I had herxed so bad on oral antibiotics, and especially Doxy, literally turned my teeth green over multiple. I didn't know about probiotics. I was on a learning curve, right? But the Herx component scared me so bad because of the reactions I had had. And I would have, if I took Doxy, I couldn't walk on certain days. So I was scared. What is so different about Envita as far as how they do that is we have very specific detox protocols to eliminate. So antibiotics in, antibiotics out through specific detox protocols. So it minimizes the herxing. It can go in and take out some of those neurotoxins. They also do a lot of detox as far as coffee enemas, high dose ozones. And so there are therapies specifically to minimize the Herx reaction. Also because of the IV component, the hurt and the fact that we utilize so many vitamin IVs in support of the immune system, that it's a very different reaction. And I've seen it with patients. The impact in the herxing can be less, even though the treatment is more intensive, because it's strategic, because it's pulsated, because there's an emphasis on that detox. So I actually had less, even though I was doing an intense treatment protocol, much less herxing than I had doing oral doxy. So it's just very, very different.
Good. I'm glad that it wasn't as, it's hard when you've been through something bad medically and you're like, oh God, I'm not doing that again, to like get the courage to try again. But when you don't feel well, it's like, okay, I'm just going to try again because this is worse. So.
Well, and herxing is such a real thing. I ended up having a seizure through herxing, and I have had many patients over the years who are like, I'm not going to do anything because I'll end up in a seizure, or the Herx will trigger a seizure. And so it's, the great thing about practitioners like Dr. Warren is they know that. And that was actually one of my most impactful moments at Envita. Again, a long time ago, 2013. It was at the end of a treatment day, and I had my own seizures. I was already scared of that. So frail, so disabled. And at Envita, you sit in recliners in rooms with other patients. And there was a patient there who she was coming to the end of her treatment, and she started to tremor. And she started to tremor and twitch. And I'm like freaking out watching her do this. I had only been there a few days. And the patient care coordinator came out and the nurse came out, and they were there instantly. And I was watching her eyes, the nurse's eyes, and they were not scared about what was happening. And I had been to the doctor so many times pre-seizure, as I felt it was coming on, my body would just go into this locked paralysis mode that a lot of patients have. And it was just one of those moments for me where I realized, like, they're not scared of this illness. Like, they're here to fight with me. And that was so freeing as a patient, just being like, okay, I don't have all of it figured out right now, but they care, and they're not scared by the fact that this person had a seizure. And, and it's different. And even treatment protocols are very more in tune. That was the first and only time I ever saw someone have a seizure, was over a decade ago. But it's very different to have practitioners who are not scared of the illness and have plans to help solve it.
Yeah. And I think that's a very valid point, is getting to a place that actually knows the illness, that understands it a lot better, because many, unfortunately, in the traditional Western medicine doctors, as my father's trained as an ER physician, he said they spent half an hour maybe in medical school studying Lyme and tick-borne illness, and then they were on to the next topic. And so how are they supposed to know everything about it in half an hour of school 100 years ago? That's not practical. And so you really do need to get to a place that understands it, because that energy alone can be enough to help support you through it. And like, I was lucky enough to find an ILADS doctor, and I'm just very thankful for her, because it did help to normalize it a little bit more for me, or to like let me know that I'm not that far off base of where I need to be, and it's going to be okay. And nothing symptom wise was ever too weird for her, where she was like, I'm sure she's heard it all. So that's a very valid point, and one I've thought about, but maybe not so succinctly. So, and I know we're on a little bit of time constraint here. I guess maybe if either of you have final thoughts and really words of encouragement for people, or maybe Sarah, from your perspective, what was the best thing that has happened to you as a result of getting Lyme and tick-borne illness?
Gosh, I have said over the years, like, there's been, Lyme strips away your energy, your identity, your network. It truly does strip away. There's an immense amount of loss and grief. So I don't want to diminish that on any level, because if I could go back and undo it, I would.
Certainly.
But it does teach you to value life very differently. It teaches you to prioritize things differently. It teaches you how to take care of yourself, because you have to, like you said, okay, I have to, how do you live this way? It's like, well, if you don't live this way, if you don't adjust diet and lifestyle and ongoing treatment and all that stuff, then you're not living. And so it's in a sense, even though I feel like there's always going to be ongoing cyclical troubles or, symptoms like we talked about Epstein-Barr and different things flaring up. But it's taught me to fight. It's taught me to fight for my quality of life. It's like, okay, I'm going to swallow 65 pills. I'm going to go gluten-free. Like, it doesn't matter compared to the fact that I get to go live and see my kids and live the life I want to do. So it just puts life into perspective. And then when you have had to fight so hard, you want to make it worthwhile. So that's just been another component of like, I have worked way too hard to be here, to be alive. I want to live.
That's right. That's right. I will certainly embrace that thought very much. So it's like all that work, everything that's done, every cent, every dollar, everything that's gone towards fixing this, like I'm going to live and I'm going to have fun while I'm doing it after this. Yeah, for sure. So, well, I do appreciate both of your time very much. This has been very helpful and insightful. And if someone is interested to contact either of you, are they able, what's the best way for that to happen, please?
Yeah, you can just go online and look up Envita.com, and there's information about how to contact us if you're interested in learning more about us. So it's pretty easy. And I will say the last thing just to mention before we sign off here is that I think the most important thing for me to communicate with potential patients and people who are suffering with the disease is that there is hope, that you can get well. It's a very difficult disease to treat, but if you have the right strategies and you have the right mentality and you have the right commitment, then you can get well. So I think that's just really important for people to take with them, that there is hope and you can be optimistic with this disease, even though it's very, very challenging.
Thank you for that. That's a perfect way to end this, and that there is definitely hope for those. And Sarah's good proof of it. I'm good proof of it. Dr. Warren, I'm sure that you've seen lots of people who have gotten better, and there's plenty of evidence to support the fact that you can get better, you can recover. It just takes maybe an act of God, a lot of will, a lot of strength, a lot of money, a lot of courage, a lot of determination, but it's doable. And as humans, what else do we really have to give other than time and our best effort at something? So we may as well invest in ourselves.
Yeah, absolutely.
Well, thank you both very much. I do appreciate this. Again, I look forward to sharing this episode and getting this word out for other people to learn more about you and your organization, that there is another place there that's ILADS trained that can help people more specifically understand exactly what's happening to their body with this sickness.
Sounds great. All right. Thanks for having us.
Yes. Take care.
Hi, guys. Thank you.
Bye.